Hello, Dr. Lynn. I'm so happy to meet you. My name is Sophia De Benedetto.
Hi.
I'm 52 and I am petrified. My mother died of a massive heart attack at 55 and I look just like her. I have a 12-year-old daughter who I worked incredibly hard to conceive, but the pregnancy, I tell you, it was so tough. I had to watch my sugars, my blood pressure rose at the end, and I was swollen like a balloon. The doctor said I would never have another baby.
We can't change your genes, but let's look at what other cardiac risk factors you have, and let's see if we can impact upon them positively. You mentioned you had high blood pressure when you were pregnant. Have you had high blood pressure since?
I never had high blood pressure before, Angelina. Is this terrible?
Do you smoke?
No, never did that.
And how's your cholesterol been?
I was at my doctor recently, and she said that my ratio was okay. My HDL was a little low. My LDL was okay, but my triglycerides, they've always been over 200 for the past 3 visits. I don't get it.
Let's summarize your cardiac risk factors. Thankfully, you don't smoke. You have a family history of heart disease. This is a genetic black box that you were born with. But I like to think of it like this. Your genes may provide the gun, but what pulls the trigger? Your environment. In terms of your environment, I see 3 risk factors for heart disease. They sometimes happen on their own, but they tend to cluster together. High blood pressure, diabetes, and high cholesterol. These together comprise the metabolic syndrome. It's not a disease state on its own, but it shows that your body may be headed down the wrong path. The metabolic syndrome is really the concept of insulin resistance, which turns into diabetes and a cascade of other effects later in life. Insulin, if you look at the first slide here, these are the little blue molecules. They work like a key. They open the doors of the insulin receptors to allow the red molecules, which are the sugar molecules, into the cell. So in a normal cell, your body is able to utilize the sugar packets as the energy packets they are supposed to be. Let's look at the second slide on the bottom here. In the setting of insulin resistance, either through eating the wrong things or not doing enough exercise or genetic predisposition, here you see that the insulin receptors start to seal their locks, and the insulin key no longer works. You may have lots of insulin keys, but they don't do anything for your body, and all these sugars are hanging out in the bloodstream along with the high insulin.
You know, it's very interesting that you say that. My mother, at about this age, had a little bit of sugar, a little bit of blood pressure. I don't know what her cholesterol was, but boy, I am walking down her road, aren't I? Is it too late?
It's never too late. The metabolic syndrome tells that we are traveling down a potentially dangerous pathway, but it's never too late to start changing pathways in order to modify your cardiac risk. Exercise is going to be our key. When you exercise, your body is a natural sugar-busting machine. As you exercise, also your blood vessels start to become more elastic and your blood pressures can improve. As you exercise, you become less insulin resistant, and all those cascades that we talked about before, they start to reverse and start to go your way. I want you to exercise 20 to 30 minutes 3 to 5 times a week to start. I want you to do moderately vigorous exercise so that you work up a sweat. For your diet, I want you to cut down on carbs, eliminating simple sugars in favor of proteins and vegetables. Think whole foods instead of processed foods.
No pasta, no bread, no cannolis? I'm Italian, that's in my gene plan.
Once you slowly phase them out as part of your routine diet and you expand your palate, you will feel better, your insulin levels will drop, your sugars and triglycerides will fall, and your blood pressure will trend towards normal.
Thank you.
When Dr. Ainat first came to me about this opportunity, I really wanted to take this venue to talk to patients about diet and exercise. I think right now we're in a climate where patients are coming to me saying, you know, doc, I don't want to be on all these medicines. Can we cut down on some of them? And the answer is likely yes, but it's going to take a lot of work to live a healthy lifestyle.
As a cardiologist, I really feel that awareness is very, very important. Most women know that breast cancer is likely to afflict them, but very few of them know that heart disease is actually the #1 killer. And our mission as doctors, I think, is to treat and heal, but also to help prevent disease. And this educational session hopefully gets the point across that heart disease is the #1 killer of women, and we can change those statistics.